How was Alaska? Oh,
Nice and cool.
was it cool?
Loved it.
Hello, sorry, I didn't mean
I know, I'm
to turn my
sorry.
back to you. Thanks for being here.
That's what I just did. I don't need it.
All right. At this time, I'd like to call the meeting to order. Can we start with a roll call? Jenny, can you do a roll call for us? Were you ready for that? He will not be here.
She will not be here. Either she is working this evening.
Mr. Lucio Lynn? I'm here, present.
Present. Here. Van Bruany here.
All right, thank you. Sorry to put you on the spot like that.
She's
First item on the agenda is the adoption of the agenda. Before you all, I think we were sent the draft agenda. Do we have a motion or any
I'll move. Second.
motion? A second? Any further discussion on the agenda? All those in favor say aye.
Aye.
Opposed, say nay. Motion carries. Next item on the agenda is the approval of the minutes, the first set of minutes and.
Jenny and I just talked. We're going to skip that again. A little bit of miscommunication between her and I
Okay,
coming back from vacation. So you'll have 3 sets next month.
okay.
I think it's my fault. Probably is. I'll just take the blame if it's not.
So even the minutes for the 12th, you want to table that as well?
Those were approved last time.
They were. Okay.
Yes, those
There
are all done. The special meeting?
Yeah.
Yep, that's all good to go. I think I signed those already, I believe, for Jenny. Oh, she's gonna look at everything. We'll get back to you.
Okay.
That could be my year.
Do we need a motion to table or just move to the next agenda item?
A motion would be great.
Do we have a motion? Please? We have a motion. Do we have a second?
Second.
Motion and a second. Any further discussion? All those in favor say aye.
Aye.
Opposed, say nay. Motion carries. Next item on the agenda is board president announcements. Just a few things. First of all, I think this is Dr. Serban's last official meeting with us as health officer.
Correct.
So thank you very much. We put a heavy burden on your shoulders and you carried it through for us. So we appreciate that very much.
Welcome.
Same. Also, thank you to Dr. Fox and his service over the years. That's all I have. Next item on the agenda, health officer presentation and report.
Well, one thing I'd like to point out, there's of course many pages, 140. But I think as you go through them, department by department, starting with environmental health and going into the food services, take heed to hope, nursing, vital records, lead, etc. In almost all these departments, the productivity of the departments is substantially increased. The areas that you see decrease in are things like complaints. Well, if nobody complains about something, we don't investigate it. But things that our staff is doing almost universally is increased. So they're working harder and harder and getting things done. And I would like to publicly thank all of them for their hard work and their great productivity, as well as their very professional performance in all these areas. And I think they do a good job. I think the team is in good shape. The new director that we're coming in, I've had a lot of discussion with her, probably 6 hours in the last week, one-on-one, and many of her questions I always answer, well, don't worry about it. Your staff will take care of it. They know everything about this. And you can see from the report that that's true. And you can see from the report that they're very active, very busy, and performing quite well.
Could you just give us a prelude to what you expect next week with Dr. Prosciutto starting and your.
Yeah, she'll be starting Monday morning and she'd probably be with HR first. And then she has meetings with some of the key directors and stuff during the day. I will be here as an employee for at least 1 minute on Monday. And the reason for that is the nursing and lead department, they have a big event this weekend. And to make sure that there was professional coverage of that event, I have to be an employee so that somebody is ultimately responsible. So I will be, quote, employed Saturday and Sunday. And Monday, when I come in at 8, I'll go to HR and certify that I'm done. I've told Dr. Prosciutto I will be available that day to give any advice, and also be available in the next 2 to 3 weeks for any advice, consultations, visits, etc., that she may want or request. It will be strictly as a citizen volunteer, but I'm more than happy to help out in any way, shape, or form that will come up. They do have a budget next week, and for her to step into that, it's going to be a little rough. And but with Amy here, there should be no problems. She understands the budgetary finances of this department like the back of her hand. Although she looks up everything all the time, she doesn't have to. She actually knows it off the top of her head.
Very good. Any board members have any questions for Dr. Serban on the report?
I was curious to know with the 4-H fair, how all of the food inspections for that went. Is that, it seems like your biggest, maybe I'm wrong, but it seems like one of the biggest events of the year.
It's a big external event. I'd be happy to have our food director come up and speak to that effect. She skipped the country for that one.
We can wait for an update until next month or I just wondered if I know last year they lost power for a little while, and I was just wondering if everything went smoothly this time. I'm assuming since somebody's cruise wasn't interrupted, it probably did.
Any other questions?
Brett here. I saw the notice about West Nile, and I did see a couple of reports of Lyme disease. Anything that we should know or that you want to say?
West Nile is here basically on schedule a day earlier than it was last year. Last year it was the 19th of July, yeah, but we got 2 positives yesterday. I would anticipate with the weather patterns we've had this year that this will be another bad year for West Nile. There was a case of Tripoli already detected up in Michigan, but farther northern part of Michigan. So something that we're keeping on our radar. We are doing lots of surveillance and hopefully we'll be on top of it. As for Lyme disease, you probably saw the news article about how many Berrien County had or it currently has. We don't have quite that many, but we do still have a fair amount of Lyme disease, and it's still happening throughout the year. So something that everybody should be mindful of. Please wear your bug spray.
Thank you for all your hard work on that. Any other questions or comments for Dr. Serban?
Actually, there's one other thing I noticed in the report, in the nursing division, it said, we will be opening, July 10th, 5 days a week at both Mishawaka and South Bend. Are both the Mishawaka and South Bend, clinics going to be open 5 days a week?
Each site will be open daily.
Okay.
This is a initiative started by our nursing director in order to get more service. And by being open and staying open, then the public knows they can just drop in if, worst case, we like them to make appointments. But if they just drop in, somebody will be there in the immunization clinic to give immunizations.
Okay. Is the hope that this continues long-term. I wondered if it was like just a back to school thing or if it was.
No, this
long-term.
this is an initiative we want to do long-term. And if you look at the numbers this year, our non-COVID immunizations are up significantly already. And by opening more access, they should be up more. And, you know, immunizations prevent disease. And as I had a poster in my exam rooms, it always said an ounce of prevention is worth a pound of cure. And that's the truth.
And can you tell us a little bit about the activity this weekend, the nursing, what that is?
Why don't I have Jody come up and tell you exactly about it? It's pretty exciting.
So this weekend is our big back to school event. So we're gonna have vendors there, the zoo, different kid events, and hopefully we can bring in more people from the community. The kids, get them vaccinated.
Can you tell us where it's at in the?
It's, yes, it's gonna be over in, I don't know if it's the county city building. County Services Building in Mishawaka where our clinic is. And it's gonna be from, I think, like 10 to 2.
We'll have entertainment for the kids.
Yes, we do. So we have the zoo coming, which I'm gonna leave if there's a snake, but but we have that. I think we have face painting. We're gonna have MDYs there. I think Real Surfaces is gonna be there, or some examples. The park services, I have to talk to Shelley to see, but anything, any kind of children's event, we tried to have, so that can draw them in a little bit.
And it's just on Saturday
It's just on Saturday, yeah.
from 10 to 2.
Mhm.
Any other
That's it.
questions or comments?
Thank you.
Thank you all. Thank you, Dr. Serban. Next item on the agenda, under new business, we have item 23-53, 2024 budget for Health First Indiana.
So for the first year of Health First Indiana, the minimum amount that we will get in St. Joseph County is $3.172 million. If other counties opt out of the funding, that number will go up. So we won't have a final number until after September 1st, which is the deadline for opting in. Our commissioners have opted in, and I believe Marcel completed the Red Cap survey. So we are in and have indicated that we are going to accept the funds.
Somebody was in Alaska, so I had to.
So for this budget for the first year, what I am proposing is to cover any grant staff that would lose funding during 2024 to keep them on board. Those include our CDC CHWs. Their grant goes through the end of August 2024. So we would just need a few months for them to be covered under Health First Indiana. We will have to have any of our health trust fund staff and local health services staff be covered under Health First Indiana, as that state funding has been absorbed into Health First Indiana. We also have included our staff that is currently funded under the countywide lead initiative, as that will be done with receiving Health First Indiana. And then 2 staff that I'm not quite sure if funding will still be available to renew or not. So I included them as well. They are currently our lead grant staff, which is our perinatal coordinator and an environmental health specialist. We are still able to apply for any federal grants. So that is the hope that, you know, our CHW safety pin grant can continue, our safety pin funding can continue, and we would not need to use Health First Indiana funds for that. And so for the first year, the expenses come to $821,000.
So are you saying that's all we would be asking for?
No, we get the full amount. If we are opting in, Our county is in great shape. We're already offering every core service, or it's already being offered in our county. So there's little to nothing that we have to do to accept the funds. So come January 1st, we get that minimum $3.172 million in this specific fund that's set up for us to use 60%, 40%, between those two core services. This is just the budget that I'm saying, this is what I expect to spend for the first year, but no, we get the full amount no matter what this budget says.
Okay.
And that's for the salaries for the grants that are expiring.
Correct, that
But you also mentioned looking for other grants for those as well?
correct. The CDC grant officially ends at the end of August. I don't believe that's a renewable grant. We would have to seek other funding. So if other funding is applied for and received, then we would not need to use Health First Indiana. This is worst case scenario if funding is not picked up in any way for those services that we currently offer.
Thank you.
And under the statute, the funding rolls over. So if we don't use it, we get to keep it.
Mhm,
So we can expand programs or do other things in the future.
correct.
So I can't hear you. I am so sorry.
Yeah, we get to keep the funds.
Thank you.
Right. So the deposits will be made January 1st of 24 for the 3.172 or greater. And then for the following year, it can be 6 million or greater, depending on what counties opt in. But as long as we're providing the core services or it is being provided in our county, we get to accept those funds and it stays with us.
Thank you.
No, it's not unrestricted. Yeah, no, it's 60/40. Yeah, we got to use the 60/40.
So do you expect, like, I'm sorry,
No, I'm
Go ahead.
I'm sorry.
do you expect additional expenses as we develop additional programs?
Mhm.
And then, like, I don't know what Dr. Brishutham or Dr. Serban's even recommending, but will it change or what?
Oh, yeah, that can definitely change. And state is very flexible. They just want to make sure with the budget that is due to them September 1st, they just want to make sure that the counties are, adhering to the 60/40 split to make sure that, we're sticking with the core services that are considered the 60% and 40%. But we can amend this budget at any time. Granted, we would have to, bring it to the board and then to the council to do any amendments, because the County Commissioners Council and Auditor is asking for this budget before you to go through the budget cycle with our county health fund. So it can be amended at any time. If we want to add certain salaries, services, programs, we can do that at any time.
When I presented to the council earlier this year, early this month, I told them to expect some changes from us as programming is developed. So they understand what's being submitted right now is subject to change. And I got positive feedback from them, understanding that we're in a new process. So.
I move to accept the budget as presented.
Okay, we have a motion. Do we have a second?
Second.
We have a motion and second. Any further discussion? One question, if I may, does this need to go to the finance committee or are we good? Is there any further discussion necessary?
I don't know. Yeah,
Any other questions? All those in favor say aye.
Aye.
Opposed, say nay. Motion carries. All right, next item on the agenda, under grant request, item 2354. Applying for the health safety pin grant.
and I'll ask Robin Vita to come up to give a description of the application and what she had documented as what would be done for the program. However, we did greatly increase our ask for this program. We are wanting to have the FEMUR coordinator as well as the maternal infant health coordinator be full-time positions where currently they are part-time. So overall, our request is $358,767 for a 2-year cycle for this budget. But I'll have Robin Dewson.
Perfect. Thank you, Amy. Excuse me, Robin Vita, Director of Health Outreach, Promotion, Education. This safety pin funding proposal is to continue with our fetal infant mortality review program. So the case review team and our community action team. This is what we have held for 7 years here at the Department of Health. And where our maternal and infant health initiatives was born out of. The funding here would fund, as Amy mentioned, our full-time maternal infant health coordinator, as well as a full-time FEMUR fetal infant mortality review program coordinator. So somebody who would be dedicated to pulling cases and doing case abstractions, preparing for those case review meetings. And then the MIHI coordinator would oversee that coordinator in addition to supporting community action activities. So building on the programs that we've been running in the past and expanding them to ensure all women have the opportunity to achieve optimal birth outcomes.
Any questions?
So currently we only have a part-time maternal infant health coordinator. We've got that job description. We'd expand it to full-time. I'm assuming that would be. And then, so I think we used to have a fetal infant mortality review coordinator, but that position, is that still a position that exists in the department, or do we have to recreate it?
You are correct. So we would not need to recreate it. It currently is a contracted employee
Okay.
because at the time we only had funds to offer that part-time, and it was really hard for us to find somebody who could do that piece part-time. And when Sally Dixon was here, we had to pivot and hire somebody just for hourly work to help support her reviewing the cases and putting together the data records. So that still exists. It's just, we would hopefully expanding it to full-time, we would have an employee that would be able to just do that much more.
And are both of those jobs currently posted? The job descriptions are up to date?
The maternal infant health initiative job description, I believe, was last month. And then the FEMUR program coordinator, since that's currently filled by Lauren Rose, is not yet posted. So if funding is awarded, then that will be a conversation we'll have with Lauren and post that if needed. I'm assuming Lauren was doing this to help support us and support the work we were doing. And if she's not able to do it full time, then we would post for somebody full time.
Is she the contracted worker?
Yes.
Okay.
Yep. Yeah, I believe she's been with us for just over a year.
So I saw that the application was due today, correct? Okay. When would you anticipate finding out if you got the grant and what the amount would be? What's the
Yep.
date?
It's a very fast turnaround. So next Friday is when they plan to know
Next week,
when.
Friday.
Yeah, next week, Friday, the 28th is when they plan to let those awarded know.
Okay.
Yeah, they're trying to make their contracting process equal when the current grant cycle ends, which is September 30th.
Okay.
So that new grant contract can start October 1st. So they're trying to review and you'll see that the application was only a few questions. And I think that was in a way to expedite the decisions.
Okay.
And I assume we're keeping the commissioners up to date on what we're doing with that. So it's going to them next, right?
Yeah,
Mhm.
yeah, if this receives approval, it'll go to the commissioners.
Yeah.
Yes.
Any further discussion? If not, I'll entertain a motion.
I move to accept the application for the safety plan grant.
A motion, do we have a second?
Second.
Motion and a second. Any further discussion? Hearing none, all those in favor say aye.
Aye.
Opposed, say nay. Motion carries. Thank you. Calvin. Next item on the agenda, item 2355, receipt of the Community Health Workers COVID Response Grant.
And this is year 3 of 3 for the CDC CHW grant. Attached is the application that was submitted as well as the budget for the cycle of the 3rd year. Just asking for approval to receive the funds and then to budget as stated on the sheet.
So moved.
We have a motion. Do we have a second?
Second.
A motion and a second. Any further discussion, questions? Hearing none, all those in favor say aye.
Aye.
Opposed, say nay. Motion carries. Next item on the agenda, item 2356, receive the health immunization supplemental grant.
That is correct. This is a grant. This will be our 3rd year receiving this grant. It came to us along with the health immunization grant, which received approval from the Board of Health last month to receive. This is an additional $324,000 for our immunization efforts. And around $181,000 would be coming back to the Department of Health as salary recovery for staff that we currently have doing immunization.
Great.
I move to accept this grant.
We have a motion. Do we have a second?
I have a second. I do want to ask a question though.
Any further discussion?
Yes, oh, thank you. I think in part because it looks like the contract doesn't have an end date, but like they didn't put it in. It commences July 1st. And when's the end date for the contract?
It's 1 year, so it's June 30th of 24.
Okay, okay. And then the other question I had, it said that one of the things we have to do is conduct school located vaccine clinics. So I'm assuming this is correct. The mobile clinics, is that fulfilling that requirement?
Correct. Yes.
Okay.
You said this is the 3rd year. Do we expect it next year? Is there another year after this or? is this
We're
a 3-year?
hoping, no, we're hoping it does continue because the first 2 years it was considered a COVID supplemental grant. And since the emergency has ended with COVID, they shifted it to immunization supplemental. So we are hoping it does continue in tandem with the immunization grant that we also get.
It's not anticipated that would be part of the big state.
The Health
funding.
First Indiana,
Yeah.
the federal funding is completely separate. Correct. Correct.
Okay.
Yes,
So this is a federal funded program that runs through the State Department.
that
of
is
Health.
correct.
Got it. Okay.
Correct. So there is an option to write for it again in 2024.
So, I guess, again, who is, what salary recovery, what positions? Is it what's on the back?
It's going to be the
This,
nursing registrars and the director of nursing.
Okay.
We would be funding the insurance billing specialist through this grant.
Okay.
And then the others would
that's-
be,
That's the new position, correct?
correct. That's a new position, correct. The job description hasn't come to the board yet. We are still working, getting something finalized, and then it'll come to the board for approval, and then we're able to post for it and get applications.
Okay. Maybe this is, I guess it's kind of an unrelated question, but I thought I saw in the SB4 legislation that, is there like a certain, if you hire somebody with SB4 money, is there like a certain posting requirement?
If it's a brand new position and you're using Health First Indiana funds, there is a 30-day posting period.
Okay,
Yes, but if it's, for instance, like the staff that are currently on staff and just being funded from this pot and we're moving them to Health First Indiana, that does not apply to them. It's just brand new positions that are being started with the department and Health First Indiana funds are being used for.
okay, thanks.
Any further discussion, questions? Hearing none, all those in favor say aye.
Aye.
Opposed, say nay. Motion carries. We have no old business today. Board notifications, looks like we have none. No hirings, resignations, retirements, or terminations. That's good.
The official listing of our new hires will be on next month's report. So I know that's a little confusing, but we're kind of 1 month in arrears.
Yeah.
Do we have any updates? on
Okay with me. Would you-
hires?
Any updates on new hires that you can share, or is it premature?
Well, we have our new emergency safety officer starting on Monday. Dr. Pursutham, our health director, will start on Monday. We have interviewed for the head of the HEEDS, the director for the HEEDS department. And we had second interviews with our 2 finalists out of all the pools. It's a choice of between 1 A+ and 1 AA+. So whoever we make our final choice will be an excellent choice. We're very, very happy with that. We have a community health worker that's going to be with the Women's Care Center. So yeah, we're active and more to come.
Next item on the agenda is public comment. This is just a public statement for everybody. At regular meetings, the public is invited to address the board for 3 minutes regarding items posted or not posted on the agenda. Individuals may speak only once during this section of the agenda. Speakers shall properly identify themselves by stating their name and address for the record. Personnel issues are not to be addressed during the open sessions of the Board of Health. The board president may interrupt, warn, or terminate a person's statement if it becomes personally directed, abusive, obscene, or inflammatory. And if you do want to speak, you have to sign up somewhere over here by Jenny. No? Yes?
Trina Robinson, 914 Lincoln Way West, NAACP president. I'm not going to be here before you long. It's very short. But I was on the United States Census Bureau, and the population in South Bend is 103,110 people. And of that, 58.1% is white, 25.2% is Black, 15.8% is Hispanic, 8.6 is 2 or more races, and 2.0 is Asian. Then when I come here every time to this board meeting, I'm seeing 100% white. We must and we shall do better. And I feel as if I step back in time, and I'm not going to say how far back I've gone, but this is something that should not happen here in South Bend. Thank you.
Jenny, anybody? Oh,
Good evening. I am Catherine Redding, and I am most concerned about data when it pertains to lead poisoning. The last data that was actually collected on test rates here in South Bend was between 2005 and 2015. And I'm just wondering, like, when is the data going to be updated? I hear that there is not at this time any legitimate pipeline for that. There's no infrastructure to pull that data. But I'm concerned because of the test rates being so high here in Indiana and South Bend as a whole. And I'm just want to bring it to the department's council to figure out if that is something that we're currently staffing. I see that, we have the CHWs coming aboard and, the executive staff, but who's working on that ground level work to give those projections with the population? I think was like 75% of tested came back with elevated blood levels. So I withdraw. Thank you.
Thank you. We'll try and get that answer at our next report from the health officer. That concludes public hearing. Thank you. Next item on the agenda is the time and place of our next regular meeting. August 16th at 4:30, right here in the council chambers.
I will move to adjourn.
We have a motion. Do we have a second? Motion and a second. Any further discussion? All those in favor say aye.
Aye.
Opposed, say nay. Motion carries.